Why, hello again. I hope you checked out my Acetaminophen, or however you say that, video, because now I'm continuing basically on from that one. I'm going to look at ibuprofen. At least this one I feel like I can say better. So, ibuprofen is Advil, Motrin. That's about all. That's the only brands I know that they show. Let's get into it. So, what is ibuprofen? It's a non-steroidal anti-inflammatory drug, NSAID. Well, that's kind of handy right there, because I keep seeing NSAID on the bottles, and I'm not sure what that actually means. So it's non-steroidal anti-inflammatory drug. So that's good. It works by reducing hormones that cause inflammation and pain in the body. Okay. Ibuprofen is used to reduce fever and treat pain or inflammation caused by many conditions such as headache, toothache, back pain, arthritis, menstrual cramps, or minor injury. Okay, I think the acetaminophen didn't have menstrual cramps or minor injury. It had the other things, but didn't have this. It also isn't an NSAID. So those are differences right off the bat. Ibuprofen is used in adults and children who are at least 6 months old. Warnings. Ibuprofen can increase your risk of fatal heart attack or stroke. Do not use this medicine just before or after heart bypass surgery. Ibuprofen may cause stomach or intestinal bleeding, which can be fatal. These conditions can occur without warning while you are using this medicine, especially in older adults. Do not take more than your recommended dose. An ibuprofen overdose can damage your stomach or intestines. Use only the smallest amount of medication needed to get relief from your pain, swelling, or fever. My only thing that I could think of with that is it says use the smallest amount of medication needed. So I don't know, say the dose is 2 pills. Are they saying just take the 2 pills and call it a day? Or are they saying try just 1 pill and take 2 pills as a max? That's something I've never understood. Like I said, I don't usually take stuff, so it's a legit question. I just don't understand. That's why I'm trying to learn. Anyway, before taking this medicine, you should not use ibuprofen if you are allergic to it, or if you have ever had an asthma attack or severe allergic reaction after taking aspirin or a different NSAID. Ask a doctor or pharmacist if this medicine is safe to use if you've ever had heart disease, high blood pressure, high cholesterol, diabetes, or if you smoke. Smoke? I didn't know smoking could have some kind of interaction with this. Well, actually, I should say I didn't know smoking would matter with any, like these over-the-counter type products. Acetaminophen, well, let's just say the brands Advil, Aleve, Tylenol. I didn't know. Anyhow, a heart attack, stroke, or blood clot, stomach ulcers or bleeding. That one would make sense because it says it can cause intestinal bleeding. So if you have ulcers or anything, chances are this could make it significantly worse. Liver or kidney disease, asthma, or if you take aspirin to prevent heart attack or stroke. Ask a doctor before using this medicine if you are pregnant or breastfeeding. If you are pregnant, you should not take ibuprofen unless your doctor tells you to. Taking an NSAID during the last 20 weeks of pregnancy can cause serious heart or kidney problems in the unborn baby and possible complications with your pregnancy. Wow. Never knew that before. Do not give ibuprofen to a child younger than 6 months old without the advice of a doctor. How should I take ibuprofen? Use ibuprofen exactly as directed on the label, or as prescribed by your doctor. Use the lowest dose that is effective in treating your condition. An ibuprofen overdose can damage your stomach or intestines. The maximum amount of ibuprofen for adults is 800 milligrams per dose, or 3,200 milligrams per day, 4 maximum doses. 8 times 4, 32. So they're telling you that the 32 is absolute max per day. A child's dose is based on the age and weight of the child. Carefully follow the dosing instructions provided with children's ibuprofen for the age and weight of your child. Ask a doctor or pharmacist if you have questions. Take ibuprofen with food or milk to lessen stomach upset. Again, that would make sense because it says that this product can cause intestinal bleeding and such. So if it's just going in there empty, then it's probably got a higher chance of messing with your intestines than if there's food flowing around in there as well to kind of form a barrier. Although milk, I don't know about milk. almost feel like milk might make you sicker. I mean, if you drink milk on an empty stomach, sometimes that can make you feel sick. Anyhow, shake the oral suspension liquid before you measure a dose. Use the dosing syringe provided, or use a medicine dose measuring device, not a kitchen spoon. You must chew the chewable tablet before you swallow it. You must store at room temperature and away from moisture and heat. Do not allow the liquid medicine to freeze. What happens if I miss a dose? Well, kind of like with acetaminophen, I don't think it really matters because this is mostly just pain reliever. What happens if I overdose? You're going to want to seek emergency medical attention and call the poison helpline at 1-800-222-222-1222. Overdose symptoms may include nausea, vomiting, stomach pain, drowsiness, black or bloody stools. Okay. Acetaminophen was clay-colored stools. These are black or bloody. Coughing up blood. Okay. Shallow breathing, fainting, or coma. Wow. Ibuprofen overdose sounds a lot worse than the Tylenol one. Coma? You could go into a coma? Jeez. What to avoid? Ask a doctor or pharmacist before using other medicines for pain, fever, swelling, or cold and flu symptoms. They may contain ingredients similar to ibuprofen, such as aspirin, ketoprofen, or naxaprin. Avoid taking aspirin unless your doctor tells you to. If you also take aspirin to prevent stroke or heart attack, taking ibuprofen can make aspirin less effective in protecting your heart and blood vessels. If you take both medicines, take ibuprofen at least 8 hours before or 30 minutes after you take aspirin, non-enteric coated form. That's kind of weird. Take ibuprofen at least 8 hours before you take aspirin or 30 minutes after? That's a weird window. Much like with Tylenol, avoid drinking alcohol, as this may increase your risk of stomach bleeding. Ibuprofen side effects. Get emergency medical help if you have signs of an allergic reaction to ibuprofen, which include hives, difficulty breathing, swelling in your face or throat, or if you have a severe skin reaction, such as a fever, sore throat, burning eyes, skin pain, red or purple skin rash with blistering and peeling. Get emergency medical help if you have signs of a heart attack or stroke, which include chest pain spreading to your jaw or shoulder, sudden numbness or weakness on one side of the body, slurred speech, leg swelling, or feeling short of breath. Stop using this medicine and call your doctor at once if you have changes in your vision, shortness of breath, even with mild exertion, swelling or rapid weight gain, a skin rash no matter how mild, signs of stomach bleeding, which would be bloody or tarry stools, coughing up blood or vomit that looks like coffee grounds, liver problems. These would be nausea, upper stomach pain, itching, tired feeling, flu-like symptoms, loss of appetite, dark urine, clay-colored stools, or jaundice. If you end up having low red blood cells, anemia, this would make your skin be pale, you'd feel lightheaded or short of breath, you'd have a rapid heart rate, and you'd have trouble concentrating, or if you notice you're having kidney problems, which would include little to no urinating, painful or difficult urination, swelling in your feet or ankles, and or feeling tired and short of breath. Wow. A lot of these are short of breath. If you had anemia, kidney problems, and what was the other one? Oh, yeah, it was just mentioned up here, but 2 of them. Wow, I didn't know kidney problems would make you have short of breath. I understand the anemia, but kidney problems? Common ibuprofen side effects may include nausea, vomiting, or gas, bleeding, or dizziness and headache. Well, I guess you'd be lucky, I suppose you could say, if all you had was gas. I mean, compared to everything else, it's not that bad. This is not a complete list of the side effects, and others may occur. Call your doctor for medical advice about side effects. You may also report a side effect to the FDA. What other drugs will affect ibuprofen? Ask your doctor before using ibuprofen if you take an antidepressant. Taking certain antidepressants with an NSAID may cause you to bruise or bleed easily. Ask a doctor or pharmacist before using ibuprofen with any other medications, especially cyclosporine, lithium, methotrexate, a blood thinner, heart or blood pressure medication, including a diuretic or water pill, or steroid medicine, such as prednisone. And that looks like that's everything on ibuprofen. So, in comparison to the Tylenol one I did, it sounds like it offers more relief options. Like it said, mild injury and I think menstrual cramps, which the Tylenol, the acetaminophen, doesn't do. But it also sounds like there's a lot more brutal side effects, such as possible comas or bleeding, throwing up blood, or bloody stools. Ugh. Never realized ibuprofen was kind of threatening, if used wrong at least. Anyhow, that's it for this one. So thanks for checking this out with me, and until the next one, I hope you already know, I said see ya.